Hello, I'm Jeremy Fernandez. Authorities across Australia are urging all of us to stay vigilant in the fight against COVID-19 after some positive signs emerged over the Easter weekend. Just 32 confirmed cases were registered today, taking our total to 6,314. New South Wales still has the most infections with 2,854. However, there were only 7 new cases identified in the state in the last 24 hours. Victoria added just 3 cases, taking its total to 1,268. Western Australia also recorded 3, the lowest daily increase in the number of cases since the testing regime began. In South Australia, the ACT and the Northern Territory didn't even add to their totals today. However, self-discipline and resolve are being called for, with 59 deaths nationally now. The most recent death in New South Wales was of an 82-year-old man. Tasmania recorded its 5th death after a woman in her 70s died at a hospital in Burnie, and a 74-year-old man in Adelaide became South Australia's 4th COVID-19 victim. He's the 16th fatality directly related to the outbreak on the Ruby Princess cruise ship. The encouraging figures show severe restrictions are starting to have an effect, which means that national curve is now flattening. The number of new cases across the country fell below 100 multiple times this week. Health authorities will be looking to consolidate these results, particularly today's, in the coming weeks. A large part of the good news is down to fewer overseas travellers who had previously made up a large proportion of those numbers. Now that there are fewer people coming in from overseas, we're getting a figure that reflects proportionally more community transmissions of coronavirus among local carriers. The Chief Medical Officer says although the signs are good, strict measures will continue for some time.
There's no place in the world I'd rather be than Australia at the moment. Having said that, as my colleagues have been saying for the last few days, we cannot become complacent. We have to keep our pressure on and make sure that we don't end up like countries in the world that you've all seen on the news, where this pandemic has developed uncontrolled community transmission.
Well, as Dr Murphy notes, it's important to note Australia's trajectory of infections compared to the rest of the world stands favourably. Population densities need to be kept in mind when you look at these figures of confirmed cases, but the key influences in each country's curve are the severity of restrictions and how early they were implemented. The US is now the country with the most deaths and the most confirmed cases. This week, the total number of those killed by coronavirus worldwide passed the grim milestone of 100,000. At the current rate, more than 7,000 people a day are dying. In the US, images from Hart Island in the Bronx shocked many Americans. Prisoners from a nearby jail dug mass graves while wearing protective suits. The site has been used for more than 150 years by city officials as a mass burial site for those with no next of kin or families who can't afford funerals. As the death toll grows, the only long-term solution is a vaccine, and that's not a sure bet. More than 60 are in development across the world, but at best a result is still 12 to 18 months away. Most experts say even that's wishful thinking because vaccines usually take at least 5 years to develop. But preclinical trials for Australian products are now taking place, with the University of Queensland playing a major role. Professor Paul Young told 7:30 this week they're working at the fastest pace possible.
Most vaccine development occurs in a sort of pipeline of activities, and it's a linear pipeline. So we have milestones that we need to hit, and each time we hit that milestone with a success, we move on to the next stage. And really, that has defined that 18-month timeline. Traditionally in the past, most vaccines have gone out to 5 or 10 years in development. So 18 months is still a radically short time. But what we've done recently is we decided to uncouple the last stage of vaccine development, which is the manufacture, and actually see if we could run it side by side with the clinical trials. And hopefully we're going to be able to cut about 6 months off that timeline. So we're now looking at the 12-month timeline, say around about the early 2021.
Meanwhile, 2 of Australia's top scientists in the field are also cautiously optimistic about that timeline.
The new technologies are really focusing the immune response at the very particular part of the virus that we know is going to inactivate the virus and prevent it from replicating in these deep tissues. So it's really a focused approach instead of a scattergun approach as was used before. This is a whole new era for making vaccines, and one that's emphasising speed because we understand the pain that the community is going to give us time, and we're trying to honour that sacrifice.
I think there is a good chance that by the end of this year we will have at least the preliminary elements of the clinical trials in humans, and I anticipate that there will be a decision made by the end of this year whether to proceed straight into using the vaccine or whether to hold on and do some more work.
So with a vaccine not on the table until next year at the earliest, how long will government support be needed? This week, the biggest economic rescue package in the nation's history passed federal parliament with bipartisan support. The mammoth $130 billion scheme is aimed at helping an estimated 6 million people. Here's political reporter Andrew Probyn.
The $1,500 a fortnight JobKeeper payment rolls out from May. To qualify, a business has to suffer a 30% fall in turnover. That threshold's been halved for charities, while big businesses will need to demonstrate a 50% fall in turnover. Anyone who misses out can apply for the Job Seeker Allowance, the rebadged unemployment benefit, worth $1,100 a fortnight, even more when other payments are added.
This, the People's House, will deliver for the people of Australia.
This is good legislation. It will make a difference to people as a result of what we do in this parliament.
Well, the information and regulations around coronavirus is changeable and sometimes even unclear. We've received tens of thousands of questions here at the ABC, and we've put some of those questions to the Melbourne-based GP, Dr. Viom Sharma, and national medical reporter Sophie Scott. If you have a cut or abrasion on your hand, does that increase the chances of contracting the disease if you touch an infected surface?
Well, that's interesting. I guess you would need to think whether there was some droplets getting into that cut. You'd need to find some way that it was actually going to become invasive. So I think it would be unlikely, but I guess it would be, a good idea if you do have any cuts or anything to be making sure that you're wearing, proper Band-Aids and bandages and not having exposed wounds at this point. But what do you think, Dr. Sharma?
Well, I think it's a really good question. It demonstrates the complexity. So if we just go by infection control principles, the skin is probably the biggest immune barrier there is. And so if that's breached, then by all means, that means that if droplets were to get in, that might be a risk. Now, there's other factors there too. For example, the SARS-CoV-2 virus loves to attach to parts of the body that has these ACE2 receptors. Now, are they at the specific site you've got the cut, and who knows? And are we going to run the trial on half the people with cuts and half the people without cuts and see who gets the infection? No. It's very sensible what you're saying. Cover the cut, take every precaution possible while we learn more about the virus.
As we've heard repeatedly, it seems that a vaccine is at least 12 to 18 months away. Beatriz Vallador of Facebook asks, will coronavirus until then repeat each year like the flu? And what are the chances of a vaccine actually being reached inside that time frame?
So it's one of the main theories that's been posited by a lot of virologists is that something that's just going to become part of our environment, this soup of microorganisms that we live in. And look, I think it is very possible that we are going to have a vaccine. The time frame, on one hand, 18 months is an optimistic time frame. On the other hand, has there ever been a more concerted effort to build a vaccine towards a single organism? We can do some pretty extraordinary things. I wouldn't be surprised. And not to mention, vaccines are not the only form of treatment we're looking at. We're looking at potentially antibody treatments from the serum of people who've recovered and medications that might be able to mitigate things. So there are many reasons to be quite optimistic. But a vaccine looks like perhaps the most surefire population-based way to attack this. And what can I say? There's people who are working very hard on it. And if we're lucky, we'll get something sooner than 18 months. I
want to come back to this question about isolation, which has a few people tied up in knots. Very simple one. Can we get a car service?
So I think, with the car, getting your car serviced, I think if you don't need to do it, then I would put it off. I've put getting my car serviced off. because I don't think, unless I need it desperately at the moment, I think it's, again, the risk-benefit analysis, and I don't think, my car is fine. I don't really need to get it serviced at the moment, so I'm putting that off. On the other issue of getting a car service, like coming to pick you up like an Uber or something like that, again, it's a risk. The advice is to sort of sit in the back seat of the car and to not, make sure you're disinfecting, washing your hands if you can when you get out. But again, it's still not, you're still going into an environment where you really don't know how well cleaned that environment is, and whether the person that you're getting the lift from might even have the virus and not know it. So it's again a bit of a risk. What do you think, Dr. Sharma, about those two things?
Look, the car servicing, if we're talking about, actually fixing up a car, my car is total trash, and it probably is due service. And there's almost this kind of trade-off of, what do I really need the car for? And really, the reasons personally I think I would need the car is to take care of my family, who my father's actually quite frail and ill, and one would argue that I need to have an efficient, safe method of transportation. So it's one of those excellent kind of nuanced questions. There's so many kind of layers to, but anything that I can put off, I will put off very confidently. So I think that, kind of the guts of your answer is just spot on.
And if you want to hear more questions and answers, you can check out our full 40-minute chat on the ABC News YouTube and Facebook channels. We'll be live streaming those Q&A sessions every Friday at 3:15 Eastern Time. We hope you can join us. And of course, you can stay up to date with the latest on the special coverage page of the ABC News website. Keep those questions coming in. Thanks for joining us.